I'm Thomas Baldrick for Oncology TV here at the 2015 ASCO conference, joined now by Stephan Chan, the Chinese University of Hong Kong doctor. Thank you, sir, for stopping by.
Hello, nice to meet you.
Let's talk about the phase 2 clinical trial on axitinib and TACE for HCC. Why did you undertake this study?
The reason is because the standard treatment for a lot of inoperable HCC is the TACE, which is a transarterial chemoembolization. We know the response is not very bad, but not very good, especially for those patients with large tumor or multifocal tumors. So we're thinking about adding a drug, which is targeting angiogenesis. Remember, the TACE is also targeting the vessels. We embolize the vessels, hoping that we create a hypoxia environment so the tumor won't grow. We're thinking about if we add another drug which also anti-angiogenic in mechanisms, so that we can stop the tumor from growing and there's some synergistic effect.
Let's fill people in on the study methods you used.
We are conducting a phase 2 studies. So it's a single arm study. We recruit those patients with an inoperable large liver HCC, and then we treat them continuously with the axitinib 5 mg twice daily, and we assess the feasibility of a TACE every 2 months, because a TACE we cannot do it every day. The patient needs to be rest from the chemo and also from embolization effects. Every 2 months we assess, so that then we will continue to give the treatment till progressive disease. And we'll monitor. The primary endpoint of this study is the 2-year survival rate. And also the secondary endpoint include the response rate and also the toxicity. What's
most important of the results that you got?
Very impressive, because we do see a high response rate of the tumor. Around 30% have complete response according to the modified RECIST criteria, and also around 80% of patients have stable disease for a period of time. Another important signal is we observed 6 patients initially with unresectable tumor, but after this treatment, their tumor shrank, and then they are able to undergo the curative surgery, hepatectomy. And after resection of the tumor, all 6 patients of the 6 patients that went undergoing surgery have pathological remission, extensive necrosis of the tumors, and they survive very long. The survival rate of these patients is very long. So this is another key message. The third message is the combination. Initially, we may be worried about the combination may create more toxicities, but we don't see this problem. The main problem is some hoarseness of voice, some handful skin reaction, fatigue, but most of them are self-limiting, and in terms of grade 3 toxicity is very low, talking about 20% only. So most of the patients can tolerate drug very well without any problem.
Now, Dr. Chan, you're optimistic about going forward with this study. Tell me what your plans are.
So after presenting this result in the ASCO meeting, we are actually negotiating with the sponsor and the relevant body, talking about the randomized study. So this is a single arm study. We need a control. The control arm will likely be a TACE. So we're comparing the TACE plus axitinib versus TACE for this group of patients. Hopefully we can proceed to the randomized study in the future.
Well, we wish you the best of luck, sir. Thank you.
Thank you.
Appreciate your time.
Thank you.
Okay.